People who live in these tower blocks in a poor area of Melbourne are some of the most vulnerable in society. Many have underlying health conditions. That makes the strict lockdown they now have to endure a complex logistical task for the authorities that ordered it. For 5 days, which began on Saturday, 3,000 people are banned from leaving their homes. 500 police officers are patrolling the tower blocks during each shift to make sure no one breaks the law. Food and medical supplies are being sent in, and mental health as well as drug and alcohol addiction support is on hand. The state government's also offering financial help.
First things first, there will be no rent charged for those tenants for the next 2 weeks. Secondly, those who are employed and because of the hard lockdown cannot go to work, they will receive a $1,500 hardship payment. For those households where there is no one in employment, they will receive a $750 hardship.
The lockdown was ordered after 30 cases of COVID-19 were linked to 12 households. But the fear is the virus has spread to many more people through lifts and walkways.
This is not just a matter of 23 to 30 odd people. This is a matter of many hundreds who've already been exposed and who may already be incubating.
While most of Australia is opening back up, the state of Victoria's recorded an increase in COVID-19 cases since last week. In 12 suburbs, people are only allowed to leave their homes to go to work, exercise, see a doctor or buy food. In the 9 tower blocks where people face the severest restrictions, doctors say it'll take around 5 days to test all 3,000 residents. Victoria Gatenby, Al Jazeera.
Well, we can now speak to Sanjaya Sananayake. He's an Associate Professor of Infectious Diseases at the Australian National University, and he joins us now on Skype from Canberra. Sanjaya, I see that Victoria's Chief Health Officer is now warning of genuinely explosive potential, especially in these tower blocks when it comes to spread. What's driving the concern here?
Yes, Nastasia, thank you for having me. It was really only a couple of weeks ago that we were quite happy with the situation in Australia. And then we have seen this surge in Victoria, predominantly Melbourne, where, say, in the last 10 days, we've been averaging overall over 50 cases per day. Now, compared to some parts of the world, that seems to be minuscule, but compared to what we were having, that is a big jump. And as you know, that this can become an uncontrollable surge if we don't control it now.
Well, there's been plenty of discussion about just why this is happening in Melbourne rather than elsewhere, Sydney, for instance. And I see the state government decided to use private contractors rather than police, as New South Wales did, to enforce hotel quarantines for travellers. And I see reports have also emerged of some fairly egregious breaches. How has that contributed to spread here?
Yes, we weren't quite sure why this happened in Melbourne. We always thought it would, if it were to happen, it would happen in one of the more populous cities in Australia, such as Melbourne or Sydney, and the cold weather might make it more advantageous for the virus. But it has since come to light that there have been some breaches in the hotel quarantine setting, which may have contributed to these outbreaks in the community. But that is still being looked into now, so we don't know all the details, but there certainly have been some goings-on which have not been ideal.
There was also that outbreak, I recall, at an abattoir, and experts are saying that secondary cases from that cluster have potentially been festering undetected and spreading through the community. Just how thorough is testing and contact tracing at the moment in Victoria?
So the testing and contact tracing in Australia as a whole has been very good, looking at our response as a nation. Melbourne or Victoria has continued to have low numbers of cases which are local transmission. So presumably there have been some a mixture of symptomatic and asymptomatic cases around. And we don't quite know how much these asymptomatic cases contribute to the total caseload, but they could be about 30%. So they are likely to be contributing to these little surges we see.
There has also been criticism of the way that the government has been handling things, particularly when it comes to communicating in a city where I think it's something like 35% of households speak a language other than English. How is that being addressed?
Yes, so it is being addressed. It has come up as an issue publicly in the last couple of weeks. and the government is going out to those communities and trying to increase the messaging to them. Because yes, it is very important. It doesn't matter what language you speak, what ethnicity you are, you can still transmit COVID to one person as efficiently as another. So it is so important that that gets done.
Can you put all of this, especially what's happening in Melbourne now, into the context of the situation countrywide? Should other cities be bracing for a similar spike to what we're seeing in Melbourne? And how might that affect the loosening of restrictions that's ongoing now?
I would say at the moment, most states and territories in Australia aren't experiencing any cases of local transmission. Sydney is certainly seeing some activity, but largely outside that, we're not having much local transmission at all. So, of course, we are very conscious of cases being exported from Victoria to other parts of the country. So we'll be on the watch out for that. But we always knew that as we started to lift restrictions, that there was a chance that we would see a surge in cases. So it's something we've been preparing for, but it's something we have to act on quickly.
Sanjaya Sananayake, then Associate Professor of Infectious Diseases at ANU. Great to get your insights here on Al Jazeera, sir. Thanks for joining us.
Thank you.